the length of your fingers or how fast you walk predict your risks for disease or death? And what do white spots on your fingernails indicate? There are lots of medical myths out there, and joining us to separate fact from fiction is Dr. Tamara Kuittinen from the Department of Emergency Medicine at Lenox Hill Hospital. Great to have you with us, doctor.
Good morning.
And let's begin with walking speed. Is there something to be correlated between walking speed, if you walk faster, and longevity of life?
Yes, there is. And this one I love. This is a fun factoid, and it makes sense. If you walk, you're healthy, and those who are older tend to stay active, or those who are healthy tend to stay active. And so there's not a lot of surprise there. I think the lesson here for us who are a little bit younger is we stay active, we'll be healthier. And it helps with mental health. With mental health, helps with physical health.
And you walk a little faster, you get your heart rate up a little bit more.
Yeah, you get your heart rate up a little bit more, and it produces positive endorphins, and you feel good. But this is all born out of a study that happened, I think, in December, was published, and looked at age, gender, and pace. And they found a positive correlation. The faster you walk, older, and gender, you're healthier.
Very interesting.
Yeah.
How about the white spots on the nails? Is this truly a sign of a vitamin deficiency?
I think we should focus less on vitamin deficiency and more on the common culprits. Trauma, hitting your fingers against things, nail polish, manicures, the acrylic nails, and also the new nail polish shellacs that stay on for longer periods of time, and you take them off, your nails peel, and you can get some white spots on it. And also fungal infections. There are some vitamin deficiencies that may result in white colors or discoloration and peeling of your nails, but let's focus less on that and more on the common suspects. There are also some systemic diseases on a serious note, like psoriasis, eczema, which can cause peeling nails with white spots, thyroid disease, which may cause brittle nails, and also commonly cold weather. My nails in the wintertime, they peel.
So it's not just white spots. If you see some of these more significant indicators, then maybe you're talking about something more significant.
Yeah, that's it.
Looking at colds versus flus, I mean, a lot of people will tell you if there's mucus involved, then it has to be a cold. Is that the truth?
No. So the body normally makes clear liquid called mucus in the nose and the airway, and that acts as a filter. It filters out bacteria and viruses, and is part of the immune system of the breathing airway system. As you get irritation, you get more mucus production. Irritation can be due to allergies, environmental irritants, but it also can be due to colds. So it may not necessarily be a cold, and so that's why we have, as physicians, some difficulty distinguishing between a viral infection or a bacterial infection, sometimes an allergy, depending on the season. So the color of the mucus can sometimes be helpful in determining.
So watch that color. Yeah. When it comes to craving ice, I've heard this, I would think that it's an old wives' tale, that you crave ice and you might have anemia. Is that true?
Maybe.
Really?
Yeah. So that's in the topic of pica. So people who are thought to chew ice probably are a little iron deficient or severely iron deficient. And the thought behind that is ice is an anti-inflammatory, it's cooling, and so it may help soothe the tongue, which also can become swollen and dry in people who are severely anemic. I would not look for a dry, swollen, painful tongue and someone chewing ice to determine anemia. There's some really common signs to detect that.
Right. Speaking of those signs, you have fatigue, pale skin, irregular heartbeat. These are some of the things that if you're craving ice and then on top of it you have cold hands and feet and all of these symptoms, then maybe you should think about the fact that you might have anemia. I want to get to this question, though, about the length of your fingers, because we've heard these tales about, if you have a longer finger, then perhaps you're more at risk for prostate cancer as a man, and that could be very scary. Is that fact?
Yes, there's some truth to that. There was a study that came out of the UK in December that looked at finger length. And so what they looked at is if the index finger is longer than the ring finger, you have a lower risk of prostate cancer as a man. Now, stop the presses. I'm not looking at men's fingers to determine whether or not they're at risk for prostate cancer. There's some other risk factors that are more important. What they did is they correlated the finger length with testosterone in the womb. So the lower the testosterone in the womb, the longer the index finger length, therefore the less likely you have prostate cancer. Wow. Is that important? Not so much. Again, I would go by the general prostate cancer screening signs, family history, age.
Thank you so much, doctor. We appreciate you being with us. And for more on medical myths, go to our partner in health coverage, WebMD.com, and search Health Facts.